Happy Saturday. Oh my gosh, I'm running a little late today because YouTube was taking forever to load. So I'm crossing my fingers it doesn't buffer. In the event it does, Instagram is always tried and true, a sure thing. So welcome everybody. Happy Saturday morning. Today I've got my keep calm and socially distance, our little peace, love, happiness fox on. So the tank. But welcome everybody. So Saturday morning, it is May 30th. It's so crazy how fast time's flying. And today is officially our 12th week together. Can you believe it? I've been hosting live shows every day except for Mother's Day and Easter. And then I'm starting to take Sundays off. So good morning, everybody. I want to kind of go through a whole bunch of news. Most importantly is a report out of France that analyzed 1,300 COVID patients, and they've identified the number one most deadly underlying health condition. We're going to talk about that today. I'm going to promise you a shorter live show because my little man is upstairs with one of our good friends in Florida having a virtual play date with her son, and they're the cutest little cutie pie. So I'm probably going to cut this short and head up there and see them. But I want to go over some important news. So globally, we're at 5.9 million cases. The US is at 1.7 million cases. New York and all the other states I report, there's some that are kind of having some movement. Most notably, California is at 103,000, and they are having record high heat waves, which is a concern given the stay-at-home orders. 221 of 386 U.S. metro cities this week alone have reported more cases than last week. So as the reopening happenings, we're seeing, at least in the metro cities, increases, which is something we need to be aware of. Speaking of the summer heat wave, New York is installing 74,000 AC units into low-income housing, and they are also helping to pay electricity bills. And many states and cities are urging utility vendors to not cut power, given the fact that we are on target for having the hottest summer ever recorded. There are certain states that have set up cooling centers, and they're all within the social distancing requirement: Arizona, LA, and even Chicago. The public housing system in Chicago, there are senior public housing units. And this week, individuals were reporting temps on their thermometer measuring 100 degrees. So they turn the air on sooner. And if you are in the southern states, like we all live with air conditioning, but northern states don't always. Same out west. It's a concept that as a Floridian, I'm like, how can you not have AC? But when you have blizzard weather, it's something that is a factor. But it's important to note. And then there are a multitude of cities right now that have inclines. And I want everybody to comment down below. First, give me a thumbs up if you love our content. And I'm excited to have each and every one of you here. For all of you new, my name is Dr. Melissa Gallagher, and I have a background in naturopathic medicine and healing from within, addressing multiple body systems in creating balance within the body, which this is really key to the topic at hand, the number one health condition that is a fatal condition within COVID. So I want to highlight some cities that are showing the incline. I'm just going to run down a list because there's actually a lot. Indianapolis, Baton Rouge, Bowling Green, Flagstaff, Arizona, Des Moines, Atlantic City, Dover, Delaware, Greeley, Colorado, Fargo, North Dakota, Yakima, I think I'm saying that right, Yakima, Washington, Kingston, New York, Hartford, Connecticut, the Metro DC area, New York City, Springfield, Massachusetts, St. Cloud, Minnesota, Amarillo, Texas, Worcester, and they call it Worcester, but Worcester, Worcester, Massachusetts, Providence, Rhode Island, Gainesville, Georgia, Farmington, New Mexico, New Haven, Connecticut, Grand Island, Nebraska, The whole Philly, Camden, Wilmington, 3-state kind of community, they're seeing spikes. And part of that's the transportation. People are coming back into work. There's, a lot of use of metro, public transportation, but also cross-border transport. Sioux Falls, South Dakota, Boston Metro, Cambridge included, Bridgeport, Connecticut. That's where one of my schools, my doctor is from. So I heavily monitor Connecticut. Albany, New York, Trenton, and the surrounding communities, Vineland, New Jersey. If you live in any of those areas, there are increases in cases from last week to this week. So just notate that. I also want to highlight the main epicenter right now is Latin America. Brazil put up 30,000 new cases in one day, and they are dealing with a testing shortage, which is even more troubling. They're at 438,000 cases, and Russia is at 379. So Brazil is number 2 in the world right now with the amount of cases. They have already surpassed Spain's death toll. They've had 28,000 deaths, and that the rate of death in Brazil is the highest at this point, which is very troubling. And Latin America overall has 920,000 cases. It is the core epicenter. There are testing shortages, and Mexico particularly have had increases in the daily cases. So every day it's the highest day and highest number of tests that are coming back positive. And here's the thing, both Brazil and Mexico, the leaders are, particularly COVID deniers or have minimized the extent of COVID globally. And then obviously we're seeing this hit their countries hard because of that denial. They were not implementing the right measures. So that is very telling. India today, so it is late at night, almost Sunday. India put up the highest daily recorded number of cases to date. So we're seeing some global trends where certain countries are having the highest numbers of cases. They have 173,000 cases. And today they had almost 8,000 cases. It was like 26 people short of 8,000. They have had almost 5,000 deaths. And they are looking at probably extending the lockdown in the country from the 31st, which is tomorrow, Sunday. They might be extending that to maybe the middle of June, but that will be probably something we'll wake up to tomorrow and will have been announced. Vietnam, so I'm going to talk a little bit about some global information. Vietnam apparently has had no deaths. They have had 328 cases. They were very prompt to contain, to isolate. Contact tracing apparently was at the best and the highest. They reacted early, they locked down, they tightened up the borders, they limited transportation in and out, halting flights to all of the countries that were showcasing cases. Early on, they quarantined. And the contact tracing, they also follow up. If you've been exposed, you have a mandatory 2-week quarantine. And they're attributing all of that collectively, all in the right timing to be effective. So about timing, let's talk about this. The CDC released yesterday the MMWR, so it's their weekly morbidity mortality rate report. And traditionally, I printed out for you. My printer, I apparently got the wrong ink or whatever. So I can't print any of my reports out, but I'll post those. The CDC has been actively tracing and identifying where the origins of the virus started, what time and where, and all the details about when did it really come to America. And what they've identified is that the virus actually came to America from Europe, and they've traced the earliest COVID cases to early January. They have not seen any evidence that November or December we had any active cases, and they look at like the genetic component, the mutation, but they have said that our community spread in America, while localized and isolated, there was still community spread in the middle of January through the beginning of February. That is very telling because these dates are after, we had it here and community spread was happening well before we implemented the travel bans. And, so that's really big information, just globally looking back. It also identifies that, like, for instance, I did 2 COVID videos. I did one in January that got actually pulled by YouTube. So, in their later censoring of this, partially it's remnants of the pandemic censorship. But that original video I posted at the end, I think, of January. And then I did another one at the end of February. Or maybe it was like I want to say it was like January 21st. And I highlighted like it's here or it's coming. Yeah, I think it was like the 28th of January, maybe. But at any rate, I did one in January, I did one in February. In February, I reported we are seeing community spread. And that was actually a month too late. Like, my reporting based on the data we had then was a month too late. So it just shows we didn't have all the details, all the information, and certainly not the measures in place to do all of this. Like, where I look at Vietnam and how quick and active and responsive they were, we look at us and we're totally delayed. And there's definitely some aspects where, like with Mexico and Brazil, we're seeing a lot of the same kind of language and bureaucratic kind of stuff that's getting in the way. So I make that statement because I think that's really telling. I know a lot of people have said, I think I had this in November. I think I had it in December. But what they've done epidemiologically, backtracking and looking at the genetic sequencing, they've identified that early January is and have showcased the earliest cases. We'll see if there's any new data and information, but they looked at a significant amount of information. Okay, so then I do want to report I know it was really big over Memorial Day, the Lake of Ozarks, the pool parties and all this. Well, apparently a pool partier tested positive. They arrived to the Ozarks, hit the pool on Saturday. Sunday, they started demonstrating symptoms. So we know you're 2 or 3 days prior to symptoms occurring that you're transmitting the virus. So at this pool party, a ton of people have been exposed, and it also exposes the lack of organization that we have, and not as buttoned up and as tight of a contact tracing process, because they're literally making statements and communicating with people over Facebook and Twitter, social media, news outlets, to highlight, like, if you are in this area, please, contact your authorities or contact your medical provider. We need to button that up if we're really going to get a good handle on the spread. Okay, so now I want to talk to you about the key factor we're going to talk about today, which is a study that just came out of France. And it's it's published in the Journal of the, I'm going to splotch this because I don't speak French at all. Diabologica, but it's like the Journal of Diabetes, essentially. I'll translate it for you. So luckily the report was in English, at least what I read. So they analyzed 1,300 COVID patients from the dates of March. Oh, shoot, I don't have it down here. It was like March 3rd to March 23rd. It was a period of several weeks. And they identified 53 hospitals, 1,300 patients. Oh, yeah, sorry, 310 through 331. So March 10th through March 31st. Of the 1,300 patients, the majority of them were men. And these are diabetes-related patients. So what this report tells us, 1 in 10 diabetes patients with COVID died within a week of contracting it or being hospitalized with severe symptoms. So these 1,300 patients, 89% had type 2, okay? 3% had type 1, and then the rest of them had some form of the disease. On day 7, so from them coming into hospital to day 7, 29% of these men, so 29% of 1,300 patients, were on a ventilator or had already died. And 1 in 5 were on a ventilator. 1 in 10 had expired from the disease. Only 18% had been discharged. And what they identified, the majority of these patients were men, and the average age was 70. And there are some factors here. If you have diabetic complications, the study found that you're 2 times more likely to die of COVID. If you're 75 or older, you're 14 times more likely to die of COVID or experience the severity of symptoms that put individuals on a ventilator. If you're 65, if the ages between 65 and 74, you're 3 times more likely to die than a 55-year-old. So I want to quick give Kim Schroeder. Kim Schroeder, thank you for the live super chat. I'm grateful. So appreciate it. Oops. Okay. So then here are some other things that are factors. Some additional underlying health conditions that sometimes go with diabetes: obesity, sleep apnea, and shortness of breath. And part of it is all together, right? And there's also inflammation of the pancreas too, that's putting pressure on the diaphragm. There's lymphatic involvement. It's a whole bunch of stuff. But if you are a patient, these patients, if they also presented with sleep apnea, shortness of breath, they had 3 times the risk factors to be dead by day 7. And the obese patients were more likely to die than any of them. So, if you have sleep apnea, shortness of breath, but you are in a good, healthy BMI, and when I say BMI, that's also a variable. Like, a lot of weightlifters and stuff have elevated BMIs, but like obesity, true obesity, where there's a lot more adipose fat tissue and accumulation from insulin resistance, the likelihood of death is greater. So this is really the report that I thought, we're going to go in that direction today, because I think this is really telling. I don't know how much that's going to get out there. There's a lot of stuff in the news right now. I know everybody's tuned into the peaceful protesting and the evening what do they call them, curfews and things like that. Like, I was up late watching all of that. So that might get swept aside, and I wanted to make sure we cover that. But also, most importantly, it tells us, particularly the study, the individuals with the diabetes, it's a type 2. Like, type 1 did not have the fatality rate as type 2. So type 2 is a preventable disease. Once it's developed, it becomes this complex metabolic syndrome challenge and meltdown within multiple metabolic systems and processes. Thyroid's one of them, the pancreas, the digestive process. We have our pituitary gland that gets involved. It's more comprehensive when it's full blown, but it sometimes is there in a what we call pre-diabetic state. We can identify those factors. We can look at blood tests. We can look at your glucose levels, your A1C levels, your C-reactive protein levels. We can get preventatively numbers and then start to have a plan of attack to resolve these underlying metabolic imbalances. So when folks are so far gone that they're relying on insulin or other, complications from diabetes, the reversal of it is challenging, but it is possible. I have worked with 80 and 90-year-old patients, getting them off insulin, lowering their blood sugar medications by resolving some of these underlying imbalances within the body. If you guys love this info, please give me a thumbs up. I see we're low on the thumbs ups. And I'm hoping all you guys are taking some notes, because these tips will be impactful if any of you feel like you have some degree of insulin resistance or glucose intolerance. How that manifests in our lives will be excess weight gain, difficulty losing the 10, 15, 20 pounds, mid-body section, experience you hold your weight in the midsection, kind of what we call the tire rim kind of area, like belly button and around, the flanks, the butt, the upper thighs. Women will present with PCOS, infertility imbalances, anxiety. I mean, there's a lot of underlying kind of elements involved in insulin resistance and glucose intolerance. And everybody's body genetically manifests certain symptoms differently than others. And so it's often individualized. But I want to share with you three tips to easily implement into your lives to address some of those imbalances. The first thing that most of this is so sad. I hate saying this because I love my medical community. I have a lot of friends that are doctors and practice integrative medicine. And here's the challenge. You're not going to traditionally hear an endocrinologist talk about supporting and nourishing your pancreas. Most of the time you get prescribed medicine or, you're on a pump or whatnot. But the pancreas is the gland that's in a malfunctioning state. It's overwhelmed, it's taxed, and it's running on empty. And that tends to be the underlying factor at play. And just to quickly kind of go over why that is, the pancreas, its core, number one, primary function is to help us digest food. Unfortunately, in a diabetic or pre-diabetic state, or if we're under stress, and I'll get to that because that's a big factor, the pancreas ends up transitioning and now it's managing insulin or our blood sugar levels. That is not its primary function. Like it is, if it's a professional, it is a baker. And it's a baker that's their hobby. They're like an excellent baker and they bake every day. Professionally, they get paid for it. But their hobby is like painting. Okay, so it's like taking the baker and turning them into an artist that's exhibiting in museums. It's not meant to do that. That's like a hobby. It's a side kind of gig. It's not its core profession. Well, that's the pancreas. The pancreas is not the artist. It's a baker. And it's meant to produce digestive enzyme batches with every single meal we eat. Big meals, small meals, snack meals, beverage meals, smoothies and things like that, whatever we're consuming, even certain beverages, especially if you've got sugar in your beverage, it's got to balance that out. And it has to help the body digest its food. And there's signaling between a little segment of the digestive tract that will signal we need, and the stomach is part of the signaling as well. The stomach will divide out what the contents are. 12% is fat, 20% is carbohydrate, 15% is protein, and it breaks all that down. It sends that signal to the pancreas. The pancreas is a little baker and it goes, okay, we need X, Y, and Z enzymes, and sends them down this like chute where it meets the food and digests it. That's the primary function. Many times, if you have imbalances in your digestive health, primarily constipation, food allergies, food sensitivities, leaky gut, candida, you have gas, you have GERD, those will be indicative that your pancreas is not functioning well. You have, diarrhea, IBS symptoms. The pancreas, that needs to be loved on. And when it's already taxed with digestive requirements, and by the way, when we hit age 30, our pancreas starts to not fail, but it's not as youthful and it's not as productive in producing these enzymatic batches, which is why we see diabetes or pancreatic failure or imbalances within the pancreas gland, why we see it being age-related. So you have to love and you have to support your liver or your pancreas, and that is critical. So number one, pancreatic love involves digestive enzymes 20 to 30 minutes before you eat every meal, particularly heavy meals. If you're eating a raw meal, there's going to be enzymes with that. But most importantly, you want to have digestive enzymes with every meal and add in a glandular. And I've talked a little bit about that. I can make some recommendations as well. There's a whole bunch of them. But a glandular could help support the functionality of your pancreas. Number two, the number one leading factor behind rises in insulin, increases in A1C levels, and it kicks off this whole cycle, brain, gut, brain, pancreatic related cycle of imbalance and missignaling is cortisol. Cortisol triggers increases in insulin production. Part of it is cortisol is our fight or flight response, one of the many multiple chemicals that the adrenals produce. There are these two little tortilla-shaped glands. it's powerful in its skewing of our insulin or blood sugar levels. And it can flood when we have high cortisol, high stress. By the way, we're all in that in quarantine, fatigue, and we're all stressed about health and wellness. And, we're cleaning everything. And then there's just a lot of news and it's just overwhelming. That's cortisol. So we have to balance our cortisol. So stress management is something that like a doctor will say, well, you got to manage your stress. It goes so deeper. This is like chemical, hormonal stress. And the biochemistry of cortisol is very taxing on both the pancreas as well as the liver. And so that's really a big factor. We have Claire on. Good morning, Claire. Okay, so then we've covered pancreas. Love your pancreas. Lower your cortisol. You can test cortisol. That's the most important way to evaluate your numbers. But then using adaptogenic herbs, you guys know traditionally, like I'm drinking my coffee. It's Saturday morning in my FSU cup. Traditionally, I am drinking my rhodiola and holy basil tea. Those are two fabulous adaptogenic herbs. They're multifaceted and can be used by everybody, highly beneficial. Chaga is another powerful adaptogen. Same with my 3-letter herbal botanical, C, and then D. The middle initial is the second letter of the alphabet. I can't say that word or get demonetized or kicked off YouTube. But that's fantastic for balancing cortisol. There's a whole bunch at play, and I've had produced a multitude of videos here on our live show for that. But that's critical. Then my third and final are the need to eat foods and consume liquid trace ionic multiminerals. So multiminerals are absolutely critical for the functionality of your pancreas. And I see a question, can someone ever reverse type 1 diabetes? It depends on a lot of factors. I know adults who get diagnosed with type 1, and that's not always what we're told. We're certainly not taught that in like school health class. But I do know one of the things is the gland itself, like any other gland, I call it puttering. They're just like, they're running on low, they're running out of gas. If you've ever run out of gas, you kind of know like that, like kind of feeling. That's what these glands do. And they get overwhelmed and we overburden them. I mean, some diabetics have really poor healthy lifestyles, poor health choices, eating the foods that are inflammatory, sugars and high fructose corn syrup and just a lot of really heavy, dense foods. It's taxing on the pancreas. And, we are what we eat. And the pancreas really does reflect that in many ways. But in type 1, it kind of depends. Okay, so the major factor here, multiminerals, liquid trace ionic multiminerals. And then also, I love to incorporate seeds and nuts, Brazil nuts, cashews, walnuts. I love pumpkin seeds, chia seeds, flax seeds. I love to incorporate the nuts and seeds because they tend to be rich and dense in a multitude of very balanced minerals. And so that's very, very critical. I will tell you too, if you are a diabetic or in a pre-diabetic state, and a lot of times they'll label you pre-diabetic, which means take action now. They don't tell you that, but you need to take action now because if you don't, it's going to be, that gland is going to continue to be deficient and not operating optimally. So 2 core minerals here, chromium and selenium. Those are critical. You hear me often talk about that for the thyroid. There's no coincidence here. The thyroid plays a big role in our metabolic function. When we have diabetes or pre-diabetes, that's a metabolic dysfunction. And when we're dealing with glands, no single gland works independently on an island. They collectively communicate with each other. We can't address one gland singularly. We ultimately end up addressing multiple. So glands that we are addressing, the pancreas, the adrenals, that's the cortisol factor. And then with multi-minerals, we see a very good balancing of the thyroid. That's part of it. So let's see, Jenny, number 3, you need to eat foods that are liquid, trace ionic, multi-mineral. Let's see. Okay. All right. So, and this is something that overnight, this doesn't just develop. We see gradual 15, 20, 30 years of gradual lifestyle challenges, poor choices, stress. I mean, even my cleanest eaters, I have some, triathletes and even, semi-professional athletes that they are healthy, outwardly looking healthy, but what's going on internally, lots of stress. So there's a balance of everything, and we have to balance that out. So I hope this was helpful. I'm going to cut my time short because I'm hearing like a dance party happening upstairs, and I have to say hi to our friends. But Brazil nuts are my favorite nuts. Brazil nuts and pumpkin seeds, eat those daily, huge benefits. And they actually have some really nice spicy ones. I'm growing pumpkin this summer. I'm so excited. I've got 2 really happy plants in our garden, which I'll be out there today and tomorrow. So watch me on Instagram. But really critical that if you are dealing with insulin resistance, we address the pancreatic gland. We deliver digestive enzymes before every meal we eat. That has to be a staple. And then lower the cortisol. Consider getting your cortisol tested. We do the home test kits, super easy, but definitely get the evaluation, and then we could take measures to balance. I promise it is so beneficial. And you think long-term, diabetes puts you at risk, not just for COVID, but I know patients who are facing amputations, they have neuropathy, they have vascular challenges, and diabetes is a vascular related disease. It's metabolic in its orientation, but we're talking about our brain health. We want to live optimally to our older ages. Then we need to really address that inflammatory state. So I'll be back online on June 1st. I'm going to talk about inflammation kind of busting. But I hope this was helpful. I know this is really short, but I really appreciate all of your time. And I want to thank Pat and Ron for our moderating. And Marfumfoli, I'm sorry, I can't even read that. Aren't spicy Brazil nuts salty? I get plain Brazil nuts, just totally plain raw Brazil nuts, no spice. They sometimes still have like a little bit of the shell on them. 3 gives you the daily dose. Now, if you're in deficiency, eat more than 3. You're not going to overdo it. So food is great because you absorb what you need, and it's very balancing. So, and Kim Schroeder, thank you for the live super chat. I'm so grateful. So friends, thanks for tuning in. I'll see you guys on Monday. Have an awesome weekend. And Shelly, this is on live so go to my story. You can watch the whole thing when it processes. It is all of my live shows. If you want to follow me on YouTube, it is housed. All the live shows are housed there permanently, unless YouTube censors it and dings me. I've been trying to back up everything so that I don't lose anything, like my UV sanitation video, which I'm going to redo. And today I'm going to share, if you guys are private members on YouTube, part of my private member community on YouTube, super easy. It's $4.99 a month. It's just another way to support us and see Inside Scoop. I'm going to give you guys the Inside Scoop of special delivery I am having today. I'm so excited. So I'll unveil that actually in a video, but it's going to be coming today. And I am like a kid on Christmas morning. I'm so excited. So anyway, it's a huge, huge thing that's coming our way. And I don't know if it's coming by freight or what, but stay tuned. I'll be posting that video specifically in more details to our private members. So you guys will get the first look. So that's one of the benefits of private membership. So thanks, everybody. Thanks for tuning in. Much love. Happy Saturday. Go take care of yourself, de-stress, get grounded, relax, drink your relaxation tea, get lots of sleep, take care of yourselves. It's so important. We can't take care of anybody else unless we take care of ourselves. So that's my message for you today. I'll see you guys on Monday. Bye, everybody. Have a great day. Thank you again, Pat, Ron. I really appreciate your support, and please send us kitty pictures. Gabriel is so excited. All right, you guys, have a great day. Bye, everybody. Thanks, Christine. Yay. Holy basil and rhodiola.